passive range of motion exercise. Now I will show the neck passive range of motion exercise. Flexion, extension, flexion, extension, lateral flexion, extension, lateral flexion, extension, lateral flexion, extension, lateral flexion, extension, and rotation of the neck. I will show the shoulder, elbow and wrist exercise. First, I will start with the shoulder. Flexion, extension, flexion, extension, abduction, adduction, abduction, adduction, and rotation of the shoulder. Now elbow, flexion, extension, flexion, extension. Now pronation, supination, pronation, supination. Next wrist, flexion, extension, hyperextension, flexion, extension, hyperextension, lateral flexion, lateral flexion, lateral flexion, lateral flexion. Then rotation of the wrist. Next thumb and finger. First thumb, flexion, extension, flexion, extension. Next finger, flexion and extension, flexion, extension. Then opposition of the fingers, opposition of the fingers. I will show the spine exercise. Flexion, extension, flexion, extension. Now lateral flexion, lateral flexion, lateral flexion, lateral flexion. I will show the hip, knee, ankle, toes and fingers exercise. First I will show the hip exercise. Flexion, extension, flexion, extension, abduction, adduction, abduction, adduction. Then knee exercise. Flexion, extension, flexion, extension. Now I will show the ankle exercise. First flexion, extension, hyperextension, flexion, extension, hyperextension, inversion, eversion, inversion, eversion, dorsiflexion, plantar flexion, dorsiflexion, plantar flexion. Next toes and fingers. Flexion, extension, flexion, extension, flexion, extension, flexion, extension. Then rotation of the ankle. Same step follow another side. Then after care of the procedure, first provide pillow to the patient. Provide comfortable supine position to the patient. Cover patient with the blanket. Perform the hand washing steps, and after that recording of the procedure. Range of motion exercise. No any contractures. All joints